Alright, so last week I talked about constipation because it's such a common healthcare issue that a lot of people go to the doctors for. Last week I talked about what is constipation, and mainly in the video I covered the causes of constipation because there's a vast number of causes for constipation. So today in the part 2 of this video, I'm going to go over the treatment and the management of constipation. Hello everyone and welcome to today's video. My name is Dr. Jasprit Singh, so let's get started on the treatment and the management of constipation. Fortunately, there are many ways to treat and combat constipation. So let's go over some of those. So I'm going to start with lifestyle modification. That's the first thing I recommend all of my patients that have issues with constipation. So lifestyle modifications include increasing fiber intake, increasing your intake of fruits, vegetables, whole grains, legumes. That really helps regulate your bowel movements. Secondly, increasing your fluid intake, specifically your water intake, not coffee, tea, or soda. Water intake. Drinking about 8 ounces glasses of water a day will really help you having regular bowel movements. And then eating prunes has also shown to help with constipation. We recommend prunes to a lot of our patients in the outpatient setting, and also even in the hospital, people eat prunes to relieve constipation as well. Keeping a food diary. Keeping a food diary can help point out which foods are causing the constipation for you specifically. Every individual is different in which foods can cause your constipation. Regular exercise. Exercising regularly can really help promote the muscles in your intestines, and which in turn will help regulate your bowel habits as well. Avoiding processed food. Processed foods are low in fiber, and a lot of the processed foods do lead to constipation as well. Probiotics. Probiotics, whether it be in food, yogurt, or supplementation, can really help with your gut health and keep your bowel movements regular. Limiting dairy products. Some individuals may be lactose intolerant. Some people are just sensitive to dairy. This is where the food diary I talked about will help you figure out which food causes your constipation. But in people who are lactose intolerant, avoiding dairy can help improve their constipation as well. Now, if the lifestyle medications do not work, the next step is medications. There are many medications that are available for constipation, so let's go over those. Over-the-counter laxatives can be helpful for short-term relief for constipation, so let's go over some of those right now. Bulk forming laxatives like psyllium husk or methyl cellulose add bulk to your stool, make it easier to pass. Osmotic laxatives like polyethylene glycol or lactulose help draw in fluid into the intestine to help soften the stools. Stimulant laxatives like bisocordyl or senna help stimulate the muscles in the intestine to help move the stool along. Now, while these medications are really good for temporary relief, they should only be used under the guidance of your doctor, and they should not be used for long-term basis, otherwise you can become dependent on them. If you guys are liking the content of this video and want to see more videos just like this one, consider liking the video and subscribing to the channel. It really helps the channel grow. Thank you. Another treatment option is addressing the underlying medical condition. Now, secondary constipation can be caused by some medical conditions. So getting to the root cause of what's causing constipation and treating that will help the constipation. I'm talking about medical conditions like hypothyroidism or irritable bowel syndrome. Bowel training. Bowel training is a method to retrain the body's bowel movements. It involves establishing a regular schedule and giving ample time for having bowel movements. This can help regulate the body's natural urge and improve bowel regularity. Biofeedback therapy. In people that have pelvic floor dysfunction, this biofeedback therapy can be very beneficial. This therapy involves using sensors that give you visual and audio feedback on the muscle activity in the pelvic floor. By monitoring and treating these muscles can improve coordination and ease the passage of stool. So those are the major treatment branches for constipation. Now the next question is, when should you seek medical advice? Now, while most constipations can probably be treated with lifestyle modifications or temporary use of over-the-counter medications, there are some instances where you should seek medical advice. I'm going to go over those right now. Severe or chronic constipation that is not improving with home remedies. If you're having blood in your stool, unexplained weight loss or loss of appetite, or if you're having changes in your bowel habits all of a sudden. And finally, persistent abdominal pain or discomfort. So if you're experiencing any of these, it's very important to seek medical care right away to make sure the condition does not get worse. So this wraps up our today's video. We went over the treatment and the management of constipation. We went through various different treatment methods you can try. Hopefully this information helps you and you guys stay constipation free and stay healthy.